Good day, citizens of the free world. From border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. Our mission is simple: searching for beneficial disruption in healthcare from emerging technologies. I'm really excited today. My guest is Rishi Madhok. Dr. Madhok has been a practicing physician for over 10 years. And of course, during that time, he's recognized significant flaws in our healthcare system, and he was inspired to start the company we'll be talking about today, BitMED. He still practices emergency medicine at UCSF Medical Center, and he's an editor at Telemedicine Magazine. Really fascinated by BitMED because it's building a new business model for the healthcare industry. So thanks for joining me this morning. Appreciate it very much.
Thank you very much, Jim. It's great to connect.
Yeah, let's just jump right into it. What problem is BitMED looking to solve?
No, absolutely. You know, when we started BitMED 3 years ago, we wanted to create a solution that offered really personalized, accessible, yet scalable care. And what we started with for BitMED then was a clinical care platform that did just that offered no-cost healthcare, 24/7 messaging or video chat with our doctors. We offer personalized content curated not just off your medical history or your health interests, but also smart content that is tailored to what you need to be thinking about, what you may not be aware of, and also how you like to engage with content. And we also take all of our members and we put them in peer-to-peer communities and discuss the everyday relevance of health. We do all of that, and again, we offer it at no cost. Why? Because the problem that we're solving is really there's too much friction in accessing healthcare. And that is what we seek to address, is that I want patients to be able to access their healthcare as easy as they access a Google search, as enjoyable as they like to scroll their Facebook feed or check their Instagram, and really feel as secure and confident in the process as we do when we do our mobile deposits on our banking.
Okay, well, thanks for that. Let me get down to some details here that fascinates me about BitMED. How can BitMED provide this service without charging patients?
Yeah, that is often the first question about the BitMED. You know, so when we looked at it, right, if you look at patients or members, you know, for the average person, when they have to think about their health, it's unfortunate. They think about their health mostly when there's a problem. And obviously, you know, it's a pretty trite example and a trite statement, but that's what's led us to sick care and costly care. And it's really because the way that we've set up healthcare to be so transactionally based. As a patient, as a member, I'm forced with the decision to say, okay, is my headache so bad that I'll take off from work? Is my headache so bad that it's worth a $20 or $50 copay? Is my headache so bad that I went to the emergency room for a $500 or $1,000 bill? You know, or will I just wait it out? Or will I look it up online now? You know, that model, one, it's not fair to the patient because they only get satisfaction or dissatisfaction or find out they made the quote-unquote right decision when they're in the doctor's office. You know,
sure.
As a business model, right, if you look at clinical care, if you look at urgent care centers, if you look at hospitals, charging the patient for that care, it creates a lot of friction. On top of that, billing to insurance, billing to these other programs, you maybe get 10, 20, 30% of what you actually bill out. And the process of actually doing that sort of back-end business of medicine it's inefficient. It doesn't work well. So we said, all right, we're just going to solve for both those problems. One, I'm not going to charge any copays, no insurance, no fees, nothing for the delivery of care to my members. What BitMED does do is we're a data company. We offer insights on anonymized data to our trusted partners. Who are our partners? They're pharmaceuticals, they're governments, they're insurers, they're other startups developing technology and products meant for healthcare. We vet them to make sure that the data is used responsibly. And, you know, the other part of the how is, well, we use technology as infrastructure for the company. We're a healthcare company, but we use blockchain, we use AI, we use machine learning for scalability, to bring in efficiencies that traditional companies can't, so that we are actually able to provide an outstanding medical service to our members at in a way that's no cost for them, but extraordinarily high quality. That is the scalability of this company comes from our solutions around blockchain and AI.
So let me ask you this. So if I was interested in becoming a member of BitMED, I'd go to your website, I guess, and create an account. And do I input some of my medical history there? Do I go ahead and put in my medications?
Yeah.
Problems, chronic problems?
So,
okay. Yeah.
Well, when we started BitMED, we looked at the option of one, just putting up a billboard or ads and saying, come for a free consultation. The catch with that is, if I offer you a free doctor today, most people probably haven't heard of BitMED. And they often think there's a catch, there's a scam, healthcare is expensive, seeing the doctor is expensive. There's no way they're offering it for free. These aren't real doctors. You hear it all. What we do instead is we actually go through channel partners. So we don't directly advertise. If you go to the website today, you can request for a sign-up code. But actually, we work through channel partners. Our channel partners are schools, churches, employers, governments, entities that have a desire to, better their members, better their clients, better their customers. They're invested in the social well-being. And so we offer them allocations of sign-up codes.
Okay.
And so instead of BitMED saying, here's a free doctor, it's your mother's group.
Sure.
Saying, here's the opportunity to sign up for BitMED for no-cost healthcare.
Sure.
You come in, you use a sign-up code. It allows us to understand and track where you came from, and also help start tailoring services to you immediately. When you sign up, you create your account. You actually create your own wallet on the BitMED platform. And I'll explain why that's relevant. And then you fill out information about, yes, your medical history, your interests. But we make that process as frictionless as possible. And then you can immediately start doing physician consultations at no cost, reading content. And the first community that you're a part of is the community you signed up through. So for our church members, they land in, and the first thing they can do is they see, Bob or John, is there for my church. I can talk to them in the church community. It gives them something to do immediately other than wait to get sick, which is, how most people start thinking about their health when they join BitMED.
And so this de-identified data, so as that data is being built, and you obviously the business part of it, the money flow is that this data is then licensed, as you mentioned, to universities, research organizations, pharmaceutical companies, things like that. Of course, we know that's being done right now. It's just the patient doesn't get any benefit whatsoever out of that. So you're bringing the benefit of, I guess your inherent belief is that that data is patient property, and they should be compensated in some way for it, and you're doing it with healthcare, correct?
Absolutely. Yeah, I couldn't have said it better myself. And, when we look at our patients, when we look at healthcare data, right, put delivery of care aside for a second, when you think about healthcare data, obviously it's a big market and there's a lot of buzz in the industry about it. Everyone's talking about how they're using, healthcare data to build out better algorithms and better AI. Why haven't we realized it? Part of the reason is because the data that we have, we go back, it's retrospective data, meaning, we're taking what we have out there. The sources we're getting it from are EHRs, EMRs, pharmacies, prior prescription. We get little pieces of the picture because we go to everywhere but the actual source of the data. The true source of the data is the patient. So that's BitMED's philosophy is the patients, the members, they are the sources of data. Let's stay with them. So if they're on BitMED's platform, we stay with them. If they're referred off BitMED's platform, we engage them when they come back, right? We want to present this longitudinal full picture of the data as best we can. And over the next few, months, years, we're actually, incorporating greater services on and off a platform to be able to engage that. But when I look at patients, when I see people, there is a big belief, all of these companies are using my data. What's the benefit to me? And often the company response in terms of Facebook, Google, anyone else is, well, you get great goods and services in exchange for your data. And that is the current, contract that people have with software companies that offer no cost or free service. What I do believe is that, we should be able, you as a member should earn from the data that you generate, but also it gives transparency on when your data is transacted and how it's used. I think that is critical. You have, this is, although it's de-identified, although, the vendors or the clients that, release or, research the data are vetted and trusted, you as a member have a right to how your data is used. And you as a member, should realize the value of your data financially, immediately. And so that is the core piece of it is. So, for BitMED, the way that we do that is we have our own blockchain. We have the BitMED protocol. The BitMED protocol allows security and accessibility around healthcare data and really healthcare and transaction of healthcare, period. That is the core purpose of the blockchain. And, we can talk about that in a minute. I'll go to the side case or the other added benefit, and that's with the BitMED token that's associated with our protocol. All data is transacted in BitMED tokens. You need tokens to access the data. So if Harvard University or a university said, listen, I want to, research 1 million patients with diabetes in Texas, age 45 to 65 on a certain drug who have done a care consultation in the past 6 months. They pick their constellation of data points they want. They're clearly presented with what the cost of that will be. They purchase the tokens and transact the smart contract. Those tokens, there's a portion that obviously comes through to help the network, but there's a portion of the tokens that are rebated back to each and every user whose data was basically transacted in that transaction. So every time the user logs in, that wallet that they set up on sign up, that wallet has a higher token balance. It grows.
One of the fascinating things is how the de-identified data is licensed. And so, I guess there are a number of startups that involve licensing an individual's DNA data. You're doing health data. Do you include DNA data in that, or are you primarily just doing their health history and health record?
So in a member's de-identified data, we offer access to a member can control what aspects are released around their data, but we are essentially focused in on behaviors and kind of the profile way through the data and through what's collected in a structured manner on the platform. We're able to kind of create a profile of our patients, of our members, really. Sure. And we use that profile then to say, okay, there are aspects of it that a trusted partner, can license for use. The other unique part is, because we have a live cohort of members, trusted partners can actually request other data and, through surveys or questionnaires to actually actively engage with our network. And we incentivize, engagement with those questionnaires through, offering part of a BitMED token or several BitMED tokens, depending on, level of engagement required with the surveys and questionnaires as well.
Sure. If one of your partners says, I'm doing some research around diabetes, for instance, and I need about 20,000 records from people who have diabetes, are they able to get that type of data from you? That's
absolutely. So absolutely, and that's one of the benefits of the platform for our partners, right? For academics and researchers, is we're looking to reduce the time it takes to do R&D, to do your clinical trials management, to do your clinical research. And so instead of trying to do enrollment for your study or enroll and look for the data, mine it, clean it up from what you're actually going to go out and get, we're saying day one, in a few seconds, you can search our network and select the criteria of data that you want, or the constellation of data that you want, diabetes, age range, location, etc., and get access to it immediately. And you can get access to it for a week, a month, a year, forever, And that's how we affect pricing on the data, the constellation of data that's presented, and obviously the amount of time that you're going to lease it. It allows us, that process, and that's obviously governed through the blockchain and smart contract, that process allows us to, again, promote that balance of security and accessibility. We know where our patients, where our member data is going. We are able to pull it back, but yet we're still able to make it accessible quickly for people to benefit from it as well.
I've been involved with healthcare technology and interoperability for quite some time, and while there's some very streamlined ways to move that data around, one of the problems, and you kind of referenced it earlier, I think you mentioned bugs in healthcare data, is how valid that data actually is. And just because somebody says they have diabetes, the only way to probably make sure is maybe by some lab results or something like that. And so is the state of commerce around healthcare data such that it's somewhat dependent on what a provider or a patient states, or is there some underlying validation of it? What are your thoughts about that?
Yeah, it is a very good question. When you look at right now how healthcare data is collected, right, in the hospital or in a clinic, often, when a patient shows up to a doctor's office, they do a history and physical. If the patient says, I used to smoke for 10 years, don't smoke anymore, well, that's what gets recorded in the record. Now that's part of their medical data. If the patient says, listen, I had a heart attack, at another hospital in 2003, and, I think they placed some stents, they will put that in the medical record as well. There isn't a lot of data validation that goes on currently. But there is this belief that if it went into the electronic health record, then it must be true. And, I think most people in the industry understand that that is not the case. Yeah. For us, we saw the same potential of, yes, we start with self-reported data, right? The patient tells us, or the member tells us health history and, what they're on, their health interests as well. But then we're able to use our incentivizations and engagement to validate it, right? So, allow us to connect to your pharmacy and validate what prescriptions you're actually on. Upload your last medical discharge. If we refer you in for a test or refer you into a clinic visit, we actually have a live human medical team of medical practice of physicians who provide care on the platform. They also work to facilitate, if you leave the platform, if we have to refer you into a service, one, we want to keep you on that treatment plan, but two, we want to actually validate what happened when you left and be able to store it. So, it starts at self-reporting. I think all of medicine starts at self-reporting. But we go out and start to capture, the best possible data that we can. We stay with the patient so that over time, the data gets refined by continued engagement, by longitudinal engagement as well.
Sure.
If you just have one chance to get the whole history right, there's going to be errors. But if I've talked to you 30, 40, 50, 100 times over the course of years, with a patient, that information gets refined and improved upon, with each interaction, as well as the way that we incentivize kind of the off-platform interaction as well.
You've mentioned some of the blockchain technology that's being employed by BitMED. Specifically, you've mentioned smart contracts and tokens. So let's talk about that a little bit. How are the well, first of all, is your blockchain platform, is it based on Ethereum? Is it based on some other platform? What are you using?
Yep. So, our blockchain is based off of a Quorum. And, we essentially developed, we have a public permission blockchain based off of Quorum. We chose to make modifications to our network and release our own network, the BitMED protocol, which is currently open source and available for other partners to build on, look at, experiment, kick around. We want this to be, the blockchain for healthcare. We use it. We validate it on our massive member platform, but we want others to build on it as well. What we saw is, Ethereum, Hyperledger taken on their own. These blockchains are great, but they're not meant for healthcare. And healthcare has specific needs, has specific stakeholders, has specific regulation. Specifically for BitMED, we needed a blockchain that would be able to service on a global scale. and, meet healthcare requirements and data restrictions on a global scale as well. BitMED offers its clinical services in the U.S., but we also offer it in Rwanda, we offer it through Africa, we offer it in Southeast Asia and Asia, in Myanmar and Mongolia, and we continue to expand. And each country, each new region has its own rules and restrictions, specifically on the transaction of care and the transaction of data. The blockchain and our network and the way that we've developed it allows for that type of A, scalability and efficiency in transaction, but B, compliance with the regulatory demands. I'm a firm believer that you can innovate, but in highly regulated fields like healthcare, you also need to follow the rules. And so that's, in a quick summary, how our blockchain or what our blockchain is purposed for, to be that foundation that if you're looking to do blockchain in healthcare, use the BitMED protocol. It's open source. We're making it, widely available for anyone to develop on. And we're showing its validation and its abilities by deploying it, in our own product, the BitMED clinical platform.
You mentioned tokens. Let's talk about this a little bit. Let's say I'm a member of BitMEd, and I have a condition. I want to have a consultation about certainly a non-emergency condition, let's say, sore throat, who knows, ear infection, something along those lines. And I know on your website you go into great detail about what types of conditions are appropriate to get advice and care from through BitMED. And so I become a member. How do I get my initial tokens? Because I think how's that work?
So, for every member who signs up, especially for this year, every member who signs up, we actually, when you complete your profile, when you onboard to the platform, you actually earn tokens then and there, right? It's the first transaction for data. It's a collection of data, but it's also like rewards, so you can start using the platform. So we deposit right now, a BitMED token into your wallet on the platform right when you sign up. You then can use that token. We'll use part of that token for a clinical care consultation. You can use it for, uploading or sharing great content. There are certain communities that you can freely join, others that you would contribute a token to join as well. All the while you're generating or sharing your data on the platform and using the platform, you're earning tokens back when the data gets transacted. Now, obviously, the goal is, with no-cost healthcare, is that your entire experience is fully subsidized by your data. At any given time, if you, quote-unquote, ran out of tokens, there's always going to be an opportunity to earn more. How do you earn more? Well, one is we offer health milestones and health challenges. And so the ability for you to log in, if you have diabetes, we'll stay with that example. If you have a history of poor compliance with your glucose, we'll offer challenges to say, okay, well, upload your finger sticks, your finger stick log each day. And every time you upload, you'll earn half a BitMED token. Or, if you have an Apple Watch, sync your Apple Watch, and try and run, twice a week to reach, a preset goal that you'll determine, and we'll have a shared milestone that way. If you were just discharged from a hospital and you have heart failure, weigh yourself each day. If your weight goes up, start taking your blood pressure. We can offer you the incentive of tokens, or if we know there was a clear event like that, we can actually say, here's a deposit of tokens, 10 BitMED tokens. For the next 30 days, you have a challenge. Weigh yourself. If your weight goes up, take your blood pressure, because those are two critical pieces of information on determining your mortality as an outpatient with heart failure. If you start skipping, if you say, listen, I forgot to weigh myself, or oops, I went 2 days without taking my blood pressure, we can start deducting the tokens you can earn out of that specific challenge. And what happens there is you actually start seeing an 80 to 90% compliance. You see this sharp, uptick in compliance on those treatment plans, because the behavioral economics kick in. After a 10% loss, people engage. They're invested. They like earning tokens. They like using them. They like hoarding them. They like having them. So we offer these opportunities. You can, through your data transaction, through healthcare milestones and challenges, through surveys, you can always earn more tokens, and then use them to subsidize or support any interaction you want on the platform.
And so, as you mentioned, then the tokens are exchanged for basically goods and services.
Yeah, absolutely. That's the other part that I'm quite proud about for BitMED is obviously you can use the BitMED token for our to engage with our physicians. You can use them for different activities and services on platform. In November, we're releasing what we call the BitMED Health Exchange. What I've seen and what we've seen in the marketplace is that there are a ton of blockchain projects. There are a ton of tokens out there, tokens that access other blockchain services, whether it's a gaming token, a rideshare token, a RX, a prescription token. What we're offering is, we will have a health, wellness, and lifestyle exchange essentially. I want you to be able to say, okay, well, you did a consultation for sore throat. You transacted a BitMED token. The physician said, okay, well, here's actually, sore throat's a bad example. You don't really need a prescription for your sore throat. But we'll say you have a cough, and the physician's concerned that you have a pneumonia. Well, the physician will write you a prescription for azithromycin. As a member, you can use your BitMED tokens to interact for the clinical visit. When you now have to go redeem the prescription, you can come to the BitMED Health Exchange and swap your BitMED token out to an RX token, a prescription token. You can then go to the prescriber and fully subsidize now your prescription. Mm-hmm. If you have to go pick up your prescription, come back to the exchange and swap out to the rideshare token, and then go and have a subsidized ride now to the pharmacy to go get your meds. The idea is that now we're increasing that interaction between blockchain services, and your data is supporting the value of your data is now being realized by actually helping your everyday life.
Yeah. I love the idea of token exchange. It's like token interoperability. That's really fantastic.
Yeah, it's like I wouldn't say it's blockchain interoperability. Yeah, I agree. It's like token, but it's service interoperability, right? A lot of people espouse utility. Sure. We really wanted people to start realizing it. The users should start realizing it.
Sure. Dr. Maddock, we're almost out of time. Let me hit you with a couple more quick questions. Is BitMED live now?
Absolutely. So anyone who's interested can come to our site or email me or our head of product and partnerships. We love working, obviously, directly with our members, but we also love working with hospitals, researchers, other channel partners, and collaborating as well. So we're happy to engage, and can definitely reach out to us through our website.
Sure. And that's BitMED, BITMED.io, correct?
Absolutely, yes.
Great. Well, I can't believe it, but we're totally out of time. So I'd like our audience today thanks for joining me on this episode of the Tate Chronicles. I offer special salute to my guest, Dr. Rishi Madhok. You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors. And Dr. Madhok, thank you so much again.
Thank you so much for having me. It's been a pleasure. Thank you, everyone, for listening. Thank you.